when I was about 10 or 12 years old. I wanted to be a veterinarian. And I worked for a veterinarian while I was 15, 16, and through high school, and then went to Auburn University for 7 years to become a veterinarian. Moved up here in 1980, opened up this clinic. All right. Basically, I want to talk about flea allergic dermatitis today. This is flea allergy dermatitis is where fleas cause an allergic response in a dog or cat, cause hair loss over the base of the tail. They cause crush, scabs. They can cause, if they get severe enough, they can cause blood loss and anemia, liver disease, kidney disease. All these things can build up with uncontrolled flea population. The first step in any flea allergic dermatitis, of course, is flea control. And we recommend the once-a-month flea controls, either the topical, like the Advantage Multi, or the once-a-month, like the Trifexis. Both of them work excellent, and you do need, that's the first step in any flea allergic dermatitis case. The next step would be some type of slowing down the immune response or slowing down the allergies. We have several different ways to do that. The first one is a nutraceutical type compounds, like this is a shake well program. You shake it up and put that on the food. Fatty acid supplementations, like the Allergy 3 capsules. Both of these, and what they work on is trying to reduce the allergies in the skin naturally. There's no side effects with either one of these, and they do an excellent job. Other things are just like shampoos that help numb up the skin or clean the skin. Those will do a good job cleaning things up and reducing the itching and digging sensation, but they don't do anything for the allergy. We don't want people to dry the animal's hair coat out. This one's an aloe and oatmeal. Again, it increases the moisture in the skin and reduces the dryness, flakiness, things like that. The next step is antihistamines. Dogs and cats respond pretty good to antihistamines. Cats a little bit don't do as well as on antihistamines as dogs do. We prefer antihistamines next. If the antihistamines just don't provide a response, we can use prednisone or corticosteroids, but corticosteroids have more side effects and more problems associated with them, and we prefer not to use them long-term or in higher doses. And then lastly, we can also use a final product called cyclosporine, which was designed through chemotherapy actually, but it's called Atopica, and it does an excellent job, and you can get by with that with usually once a day, and it'll reduce the itching and digging, make them feel better. It's an excellent drug. We have, in this area, we're fortunate enough to have a dermatologist that comes up to the Tri-Cities once a month from Knoxville, Dr. Keith Nillica. Actually, he's written a book on dermatology, the main book that we all use as veterinarians. And we're quite fortunate that he comes up once a month to the Tri-Cities area and sees cases for all the veterinarians, skin cases, bordering from severe allergies to Demodex, Sarcops, you name it, fungal infections. He's an excellent veterinarian, board certified dermatologist. So if you ever have a problem with any kind of case like that, so flea control, like I say, is a multifactorial treatment option, and unfortunately there's no one thing that does an excellent job. We recommend, of course, starting with flea control, then antihistamines if we can get by with that, fatty acids added to the diet, topical steroids, hopefully before we have to use oral steroids. We recommend HEPA air filters for the home to try to clean the environment, keep in any dust in case there's other allergies. Because if you're allergic to flea allergies, there's a good chance you might be allergic to other things, or the pet might be allergic to other things, such as house dust mites, various pollens. Some of them are allergic to wool. So again, working on, reducing the amount of exposure to different types of pollens or allergens at home. Cotton sheeting will help out tremendously, keep the allergies under control, and all that does a good job together. So it is, we try to tell people we can control allergies, we can try to slow them down, make the animals feel better, but as far as a cure, just like in people, there's no cures for allergies yet.